Hello. So, my first question would be, tell us about yourself and what you think sets you apart from other applicants. Well, my name is Shaka Tucker, and I've worked in the medical field for a little over 15 years, mostly on the administrative side, nothing clinical or anything like that. I've worked in appeals, denials, and approvals. I've worked closely with various insurance companies such as Medicaid, Medicare, and managed care companies. What sets me apart from other applicants is the fact that I'm eager and ready to take on a career that I've researched to be not for the faint at heart. Um, Getting into child protection can be stressful, overwhelming, emotional, and I'm here for it. So I would say that my passion to want to get into social services, possibly focusing on child protection, is what's going to set me apart from the next applicant. The fact that I've waited so long in my life to go back to school, just because I have the life experiences, I think that would definitely play a big part in realizing that I'm different and I'm here for it. I'm ready and I'm eager. And I think those will be some of the reasons why I would be different than the next applicant. Briefly describe your biggest professional weakness. So for me, I would say that one of my professional weaknesses would be that sometimes I'm a little too sympathetic to certain situations when it comes to people that I work with or work for. And I would say that with me focusing on child protection, you get sometimes where there are situations where you just want to take a child and hug them or fix their life, and you can't. You have to stay professional or on a professional level. Of course, we're there to fix the situation and maybe change your life, but we have to keep it professional. And sometimes there are situations that may touch your heart a little bit more than the next. So just trying to stay professional when it comes to situations like that. I think that would be one of the weaknesses that I have, especially because I have children and I've seen and heard, stories that children go through. And I don't want to come in and be that person where I feel like I'm Captain Save a person, just because I'm so empathetic to what's going on in their life. So I always have to keep it professional. So that will probably be one of the weaknesses that I have in my professional life. And that would be just sometimes being a little too emotional and sympathetic to what's going on with a person's situation. So my next question is, tell us about a time where you show grit in the workplace. Well, in my current position, I work with a team. There's 9 members on our team, and we are assigned certain floors of the hospital. The work that we do has to get done every day. So I would say that, when a person is out from our team, we always have to pick up that person's work, which is never a problem because it gets done. And sometimes other things that we have to do won't get done, but the most important things do. And there are times where our team is shortened because of people out sick or planned PTO. So we have to pick up and do their jobs and do our own jobs and and just bust it out. So there was a time where out of the 9 people in our group, there was only 3 of us on staff that day. So it was hard trying to, do my work plus the work of my other team members, but we got it done and we got a lot of compliments and praises from our supervisors that day. Our team members definitely appreciated it the next day when they realized that out of the 9 of us, it was only 3 of us there. And also, like, the other members of our staff, the hospital employees, they were also very appreciative and understanding when they realized that, okay, well, they're not full staff today, so we just have to be patient. But we got in and we got our work done, and by the end of the day we were exhausted, but we busted out. So my next question is, summarize where you see yourself in your career in the next 5, 10, and 20 years. Sorry. So in my career, in the next 5 years, will probably be more of a starter, entry level. I'm definitely focused on getting into social services. Child protection is my number one. But there are other places that I would definitely be interested in seeking employment. So I would say in 5 years, it will be more or less me just now really starting to get out. I'm not due to graduate my bachelor's until 2022. So that's in the next 2 years. So after that, that gives me about 3 years to get into a position comfortably, figure out the system, figure out exactly what I need to do and what's going on. And then by that 10th year, I should be moving up in some type of managerial supervisor position. In 20 years, I'm not going to tell my age, but I should be getting ready to retire soon. So I should be comfortable within my position in 20 years, just working every day and taking it easy in the evening, and getting ready to start my retirement. So that's probably what I'll be doing in the next 5, 10, and 20 years. Imagine you are promoted within the workplace. Describe how you would deal with your colleagues who may have been passed over for the promotion, or your coworkers who have been your peers but are now your subordinates. So for me, I've been in a position similar to that where I have now become a supervisor or a president over people that I, used to be on the same level with, I guess you can basically say. For me, I would be ecstatic. And I don't want to sound selfish, but at the end of the day, it's about me and me being able to take care of my family. And if a promotion is what's going to help me do that, I'm all for it. Of course, I would feel some type of way for my colleagues and my coworkers that may have been passed over. But if I have the skills to beat them out for promotion, it is what it is. I just, as far as coworkers that I may have had like close relationships with and now they're my subordinates, of course I would, let them know, okay, I have a job to do, and still keep our relationship. They might not agree with everything that I decide or say, and may have some type of feelings, because I'm now their supervisor. But I am that friend that can let them know, hey, listen, this is our job. At the end of the day, this is how we take care of our families. So we have to keep it professional here. Outside of here, that's something different. But, please just work with me. I'm approachable, so if you ever feel like I'm overstepping bounds or anything like that, you can always come and talk to me and we can discuss whatever the issue is as a supervisor and as a friend. I wouldn't go around, flaunting my promotion or hanging signs at my desk or anything like that. I would definitely be very appreciative to the staff that felt like I deserved that promotion. But I wouldn't sulk either. And I wouldn't apologize for me either, because if I am now getting a promotion, that means that I've worked hard to get into that spot. So the same way that I worked hard, the same way they could have worked hard. So I wouldn't feel any type of way. I'll just be happy for myself. Identify what kind of person you have difficulty working with. I would say the person that I have most difficulty working with is someone petty, childish. That's the one that kind of annoys me the most. And I just feel like, when you're in a career, you're now an adult. And there are situations that all situations need to be handled like adults, and I feel like the gossiping back and forth and just acting childlike is very annoying, especially in the workplace. I feel like if there's anything ever that I've said that may have offended or I've done, that, things can be brought to that person, instead of going, to a supervisor or, something like that. I just feel like, you know, go to the person who you have the problem with and not be so childish about everything. So that's the type of person that I really feels annoys me, or that may make it difficult to work, because then it's all about trying to please that person or make that person happy or walking on eggshells around that person, so they don't basically have a temper tantrum, like a child. So that would be the difficult person to work with for me. Explain how you handle conflict in the workplace with coworkers or with clients, patients, and customers. Me, with coworkers, I stay out of it. There are going to be times that we have conflict. That just happens. We're people. But for the most part, I say what I have to say and let it be done. There's no purpose to go back and forth. There's no purpose to, just keep things going. You say what you have to say, and that's it. As far as with clients, I've never been in a situation. Well, I've never been in a situation where I've had like a conflict with a client. There are patients that I've dealt with that have proven to be a little difficult when it's time to discharge from the hospital or sign paperwork and things like that. And I just kind of have to explain to them what the reasons are why they have to sign this paperwork. And if they decide not to just because they're being really difficult, then we just have to put that patient declined. It's no reason to keep going back and forth about situations and to even create a conflict. With customers, I've had very difficult customers in the past and previous at previous jobs. But again, I say what I have to say. I make sure I notate everything. That way I can back up myself. I never let a patient, a client, a customer, anybody dictate how I work. Because honestly, when I leave work that day, a lot of these situations and a lot of the people that I deal with, I don't think about once I leave that job. Now I'm into a different position, a different role. So that's the role I have to play when I clock out at 5:00. So I don't let, the people that I've had conflict with make me feel any type of way, about the job. It just happens when you're with people, there's going to be conflict. Everything is not going to always be happy and rosy and nice. Detail what motivates and inspires you in the workplace. Knowing that I can change or be of some type of good to someone is what motivates me. When I can hear, "Great job, Shaka, that was really nice," or a customer or a patient can say to me, "Thank you so much, I really appreciate your help," that's what motivates me. And because I know that that's what motivates me, when it comes to me talking to someone else that may have helped me out, I show them so much appreciation, for helping me, because I know that when someone shows that appreciation towards me, it makes me happy and it makes me smile. So I feel like if I do that with someone else that may have helped me, it may make them happy and make them smile. So I would say that just knowing that I may have helped someone or brightened someone's day or answered someone's question is what motivates me in the workplace. Summarize what you like best about your current or most recent job and why you are leaving that position. Well, in my current job, I just like the fact that we are able to see patients, see them when they come, and then the difference when they leave, talk to them in between time. And, you're talking to them right after, for me, I'm talking to them right after they've had heart surgery, so they're barely able to breathe. They're really weak and they're tired, and it's hard to sign the paperwork and everything. And then I see them 2 weeks later and they're up walking the hallway and they're, sitting up in bed and they're signing their papers. And it's just such a difference. So you see that progression that the patient has made from the time that they came in and I saw them to the time that they're being discharged and I saw them. So for me, that will probably be the best part of my job. Why I'm leaving? Well, my job here is not particularly what I really want to focus on, which is why I'm using the opportunity to stay in my current job and focus on school. Just because it is a lot easier to focus on school while I'm in this current position. So I would say that I'm leaving just because it's not really or exactly what I want to focus on in my life and as a career. Being as though I do want to get into social services, that's what I really, really want to do. Although I can take that social services degree and implement it here at the hospital and work on something as far as social work here. But it's not really what I want to do. I want to get more into the social services part of it, and that would be, child protection or working with at-risk teenagers or, things like that. So that's more or less while I will probably be leaving as soon as I get my bachelor's degree, which will be 2022. So I would just like to take the time. I think that's all the questions. Take the time to thank you for listening to me, inviting me to this interview, and I appreciate you. Thank you so much.